From the point of view of safety, I think the things people would notice is in our orientation for parents, we tell them that they can call a medical response team at any time. So that's a very significant step. And we do that in orientation with a clarification so that they understand sort of, what the purpose of it is, and that nobody will be upset at them if they do that, and that it is their right to call and ask for help at any time. Another thing we do now is we ask parents to do what we call stop the line. So we say, if you see anything that worries you, we're testing it in the intensive care nurseries and then we're spreading it, you can stop the line. You can simply put this card down and say, I don't think this is right. And we have a process that allows you to do that. The other thing that we know in our organization now is that people are optimistic, that there is a sense of, can do. People say that when they come in from outside. They'll say there's a buzz. People say to me, okay, I don't believe it. So I had a recent candidate that was interviewing for a position, and she said, I don't believe it. So she said that to my colleague, Bill Kent, who is, the senior VP for operations. And so he said, all right, let's go look. So we took her up to a floor where we had our board for the Pew score, where we document on each patient their red, yellow, green, and there's an algorithm, and we call teams based upon what's happening. And it was up to date, and it was obviously being used, and, it was by the board, and people were talking to it. So she came back and she said, I'm still blown away. I still can't believe it. So there is a sense of optimism, I think, in the place that the providers feel. They feel that they have the tools and they have the support. And we're not done yet. I mean, we're a long way from being done. But some of the flattening of the hierarchy and some of the respect for all kinds of people, not just because you're a physician or not just because you're this or that, is part of, I think, responsible for the change. I think they only need two things to come, in my mind. They need a sense of optimism, and they need the willingness to try. Because the cool thing about change is, if you don't like it, you could always go back to, the way it used to be. And because in the concept of a PDSA, or in the concept of testing, you're only asking people to test an idea. So nobody is coming down and saying from June 1, this is how we're all going to behave. People are saying, this is a problem with patient safety. This requires us to be able to listen to each other a little bit better. This requires us to be transparent about our problems. This requires flattening of the hierarchy. Here's some ways that you might want to do that. And if you're afraid, here's some reasons that you might be afraid. But give it a shot, make patient-centered rounds, make rounds in the rooms. The residents turn out to be the most important people to spread, because once they test it, and that's the most significant thing for me about the opportunity for change, is if you're open to testing, I'm not asking you to commit for a lifetime. I'm just asking you today to make rounds in the room with one patient and see how it feels. I think what should students be thinking about now that they don't think about? To me, the most important question I think they should be thinking about is balancing their portfolio of learning. So they've spent an incredible amount of time learning the content. Learning, if I have this, I should do this. I should use antibiotic X for disease Y. And that's really important, because when I go to see them, I don't want to get antibiotic Y for my disease. I want to get the right antibiotic. But the second part of it that they have to learn, I think, which many students are learning, is how to walk in the patient's shoes, how to be compassionate. That it's a healing profession, and I'm here really to help you. It's a service orientation. And what would it take for them to be more service oriented?